New details now in an ITM exclusive of fraudulent fees. We now received emails and calls from dozens of viewers who say that they're victims of Medicare fraud to the tune of more than $57,000.
This all comes after the I-Team reported on Tuesday about 2 Maryland residents receiving dozens of unwanted COVID tests in the mail, with Medicare paying for them.
I-Team reporter Tolly Taylor broke this story, and he joins us now live. Tolly, the I-Team has heard from a lot of people about this exact problem.
66 people have told us they're victims of fraud so far, more than the official statewide number. One viewer tells me he and his wife didn't even know this had happened to them until they saw our story on Tuesday. Did you ever receive a call offering you this test?
Never.
And neither did your wife?
No, my wife didn't either.
But after Ron Rauch and his wife saw the I-Team's report on Tuesday, he says he went online to check their Medicare statements.
And sure enough, I saw a bill for $120 for a COVID test. And of course, we never received one. We never ordered one.
The test was charged to his wife's Medicare. So Rauch says he started up this conversation online using Medicare's chat feature. He asked for help.
And there's a huge scam happening now, according to the news, about Medicare paying for unwanted or never ordered COVID tests.
His specific concern, should his wife change her Medicare number? The response from Medicare:
you do not need to request a new number. It's just not you that this is happening to.
As of a week ago, there were 40 reports of fraud like this statewide to the Maryland Department of Aging. As of Friday, there have now been 10 more reports, adding an additional 78 boxes of COVID tests that people didn't want or approve. Medicare paid for all of them, costing taxpayers more than $7,300 just in the past week.
Do you feel like you do need a new Medicare number?
I feel like, yes, we should get a new number. The other concern is, what else can they do with her Medicare information? Can they start sending in orders for other tests?
While Eloise Main at the Maryland Department of Aging says the current official statewide number is 50.
These numbers are increasing every day.
The I-Team has had 66 people reach out saying this happened to them. They reported receiving a whopping 607 boxes of COVID tests. That adds up to more than $57,000 that Medicare paid in unwanted COVID tests, all of it taxpayer money. Rauch says Medicare was helpful overall, but worries what could happen if his wife doesn't get a new Medicare number.
So my biggest concern is, how is somebody getting these numbers? Do they have her Social Security number?
Now, the I-Team reached out to the Centers for Medicare and Medicaid Services asking how the government agency decides when someone needs to be given a new Medicare number. A spokesperson says they wouldn't be able to get me that answer today, but would provide it on Tuesday. You can find out how to report fraud right now on the WBAL TV app. For the 11 News I-Team, I'm Tolly Taylor.